Hi, this is Abby Shiragi, and this is my presentation on 17.3, the case of Mildred. First, in regards to the question of what diagnosis are you considering before you visit with Mildred, I thought initially she could have possibly had delirium due to another medical condition, since they noted the diabetes complication, and perhaps there was something else going on there. So I thought of that as a consideration. And then the second thought was major and or mild neurocognitive disorder due to Alzheimer's disease. And third, not a diagnosis, but was just non-diagnosis and perhaps natural effects of aging that had gone kind of unnoticed for a while. So that was my thoughts on diagnosis. Next, just thinking about other information I would like to have, other people I'd like to interview, and any other consultations I'd like to arrange. I would have liked to speak with Mildred's husband, Ray, just talking to him a little bit about her daily variations of her routine, behaviors, moods, memory, and kind of just her baseline prior to this happening. And also talk to her daughter, Janet, to define how she described her mom as being increasingly forgetful, and help me to define also her baseline state prior to this decline that was noted. And lastly, I'd want to talk to the medical staff, including the nurses and the doctors, to discuss any pre-existing conditions, medical history, possible complications with diabetes and or medications that she was on, and additional behavioral observations. Next, my preliminary diagnosis, just based on information that was presented in the text, would be major neurocognitive disorder due to Alzheimer's disease with behavioral disturbance. At first I thought it was delirium, but then digging into it a little deeper, I decided I didn't think it was delirium because it was an insidious onset versus sudden, and then a gradual kind of progression. There was no evidence of this being due to a medical or substance condition. I defined it as major, not mild neurocognitive disorder because according to the DSM, the cognitive deficits did interfere with complete independence. And they noted in the Pomeroy text that Mildred would have trouble managing medications, feeding herself, etc. And then I noted the behavioral disturbance because they discussed how Mildred was agitated, edgy for no reason, was wandering, and experiencing some other psychotic symptoms. Listing the psychosocial and cultural factors as V or Z codes that would apply to this case. I struggled a little bit with this one, but came up with more possible ones than ones that were currently existing. One of them was non-adherence to medical treatment, and the second would be relational problems related to mental disorders or general medical conditions. And as far as the Z codes, I think one of the things that would be really likely would be problems related to care provider dependency, specifically the need for assistance at home, and no other household member would be able to render care, possibly. In assessing the strengths of the family, I think I would want to meet with them individually and as a whole, and just discuss and encourage their existing strengths, including their desire to live near each other and be involved in each other's lives. How Janet, Mildred's daughter, spends time with her mother at the hospital and very clearly cares for her well-being. And I would also like to explore some further strengths of communication, health, time together, spirituality, different support systems, respect, unity, cultural tradition, and an extended sense of family that would help them through this difficult time. Important questions for the family to consider in making discharge plans for Mildred. I think first and foremost would be the consideration of who would be responsible and capable of giving Mildred the care that she needs. So talking to both Janet and or Ray, the husband, about this, their schedules and how possible this would be. and specifically to talk about medication administration, and possibly a plan to prepare them for the possible progression of cognitive deficits that may occur if this is Alzheimer's. I would also want to discuss with them, if they did choose to be her caregiver, I would want to discuss caregiver burnout, which is accumulated physical, emotional, financial, and social stress and resources for the caregiver. And these are my references. Thank you for taking the time.